Hi everyone, I'm Nurse Nicole and I'm going to be reviewing your Follistim. So for your Follistim injection, you are going to get a Follistim pen. When you open up the kit, it will have one of these green packages. And you will receive a variety of these cartridge packs, which will stay in your refrigerator. You'll need your sharps container. And when you open up that pack, you will see that there is a pen device and some single-use needles included. When you remove that pen device, it is pretty user-friendly, so you'll remove the cap just like a regular pen would, and your pen will twist apart. You'll then take your cartridges out of the refrigerator, and each one of those cartridges will look like this. Most of these are going to be a multi-dose vial, meaning you'll load the cartridge in on the first night and likely use it for your first few injections before you need to replace. So your cartridge will drop straight into that yellow piece like this, and then you'll take that other half of the pen and twist it back together. Once your cartridge is loaded in, again, this will be used likely for the first few days of your injections. So each day that you are due to use this pen, you'll clean off the top using one of your alcohol wipes, and you will take a single-use needle from your packaging. Each one of these will be a single use, so we won't be reusing them. You'll remove the paper off the backside and twist onto your cleaned off pen. Once your needle is attached, you can remove that outer cap, and there is a second layer underneath. Once our pen needle is attached, then you will go ahead and dial up to your dose using the scroll on the end of your pen. So you'll scroll up to your dose, and for the purposes of this video, we'll use the dose of 150 units. So you'll want to see that number 150 in your window. If you over scroll and you go too far, you can continue scrolling until the end where you'll see a blank, and then you can push your pen back in to reset. You just don't want to push that button until you see that blank window, or it will eject the medications out. So again, we'll scroll up to our dose. We always want that number in the window to match what your calendar says. And once you've done so, your pen is ready to use. So at this point, you'll go ahead and pick out your injection site for the night. You're going to want to go 1 to 2 inches away from your belly button to the side or below. You'll clean your skin off using an alcohol wipe. So we'll use this as our little demo for your belly. You will use one of those alcohol wipes to clean off the skin. And when you're ready to do so, you'll remove the cap from your pen. Your pen will be scrolled up to your dose, so you'll see your injection dose in that window. When you're ready to do that injection, you'll inject straight into the skin with a dart-like motion. Once that needle is inserted, you'll take your thumb and push down on the end of your pen, and you'll see that the pen will guide itself down to 0. Once you see 0 in your injection window, you'll go ahead and remove that needle straight out, just how it went in, and let go of your skin. To remove the needle from our pen device, we're going to take that larger outer cap and replace it back on the pen. You're only going to use that larger outer cap. You do not need to replace the small one. And just how it twisted onto your pen, it will twist off. Again, these are single-use needles, so it will go straight into your sharps container. You'll place the cap back on your pen. Pen will remain in the fridge until your next dose, and the next night you'll use a new injection needle.